7:16 in This Morning in Healthy Living. November is Diabetes Awareness Month, and recent studies show that close to 20% of all pregnant women in the U.S. develop gestational diabetes. Expectant moms now have a new resource to help manage the condition. Colleen Chrisbaum is here along with Virginia Wagner from Wheaton Franciscan to tell you about a new program. Thank you for being here.
You're welcome.
Colleen, I'll start with you. 20%, that is a lot of moms who were not previously diabetic.
Exactly, and that is a new statistic by the American Diabetes Association that 18 to 20% of all women going through pregnancy are diagnosed with gestational diabetes.
So a big question, Virginia, is that when moms become diabetic during pregnancy, are they that way forever, or once they deliver, are they back to where they were?
Not everyone who develops gestational diabetes during their pregnancy will become a type 2 diabetic later in life. We do suggest, though, that when we teach you the diet modification and the exercise during pregnancy, that you continue that after pregnancy. We've shown that 1 in 4 women that will continue with the diet modification and exercise are less likely to develop type 2 diabetes, but it's depending on whether or not you can meet your ideal body weight after pregnancy.
And it's serious, not just for the child, but for the mom. Like, what are some of the complications that can arise if the diabetes is not treated during the pregnancy?
Well, for the mom, just to have a high blood sugar for an extended period of time is much like what a normal diabetic would experience, some of those complications. And then the complications that the baby would experience, a very high birth weight, when the complications along with delivering a large baby, sometimes babies will have respiratory distress upon birth. There's issues with a very low blood sugar with babies, with moms with gestational diabetes. And then not to mention the fact that there is a higher risk that in childhood they will develop obesity, and then go on in adult life with type 2 diabetes.
So very, very serious, and we know the costs, both health-wise and also economically, of what diabetes the toll that it can take.
Exactly.
So the program at Wheaton Franciscan, how does it work?
Well, we're so excited about this new program. Yeah. It's a program that's actually group-focused, so we do group education, and it's team-taught by both a registered dietitian and a registered nurse. And even though we still provide individual education to our gestational patients, women who attend these group sessions have found it to be very comforting and very supportive that there's other women that are experiencing the same challenges. So we've launched this new program at St. Joseph's Hospital in Milwaukee late October. We are hoping to expand it to Racine All Saints campus in February, and then throughout 2012 just take it on to many of our other Wheaton sites.
All right, and we do have a website for you. It is mywheaton.org, or you can call 1-888-994-3286 for more information on the gestational diabetes program happening at Wheaton Franciscan. 20% of all expectant moms in the U.S. will develop this condition. So important to know and be aware that, it is manageable, and it's important that you do. Thanks for being here.
You're welcome.
You're welcome.
It is 7:19. Let's go to Rob. Rob, you're inside.